Good morning friends, I am Dr. Ashish Saini, urologist and andrologist, and I specialize in penile implant surgery. So this is one of the videos where we'll be talking about the penile implants, the rigid ones, the inflatable ones, the 2-piece and the 3-piece. And first of all, what is the indication of a penile implant? A penile implant is placed in a patient who has severe ED, where the erections are not there even despite of first giving the drugs and then putting them on injections, intracavernosal injections, doing PRPs, doing shockwave therapy. And when we have exhausted all our methods in those patients, we have to offer them a penile implant. But luckily, the penile implants have improved by leaps and bounds, and now the penile implants can actually give you an erection which may be similar or better than a normal erection. So first of all, we'll be talking about the 2-piece implants. So this is the 2-piece inflatable implant device. In this, there are 2 rods. These 2 rods are placed inside your penis, and the rod size is basically measured by the size of the penis, and there are rear tip extenders where we see how much is needed. And in this rod there is a button. This is a button which has a reservoir as well as a button, and it is placed in the scrotum. So this implant works by the mechanism that whenever you want an erection, you just press this button. Once you have pressed this button, the fluid from the reservoir goes into the rods, and you have an erection, a rigid erection. And then once you are done, you just bend your penis like this, and the fluid from this goes back to the reservoir, and that completes the act of the erection. The other implant, which is a way beyond this, is a 3-piece implant. Now we'll be talking about the 3-piece implant, and this is the best implant which is available. It can give you a girth expansion as well as a length expansion if you go for the LGX model. 3 pieces. So basically this is a reservoir which is placed in the right lower part of your abdomen, and this is the button which is placed in the area of the scrotum, and these are the 2 rods. So in this case, what happens is that the reservoir has the fluid which is normal saline, and once you want an erection, you press this button. The fluid from the reservoir comes into these cylinders, and you have a rigid erection. And once you are done, you again press it, and the fluid goes back into the reservoir. So basically, these are an implant where there is an extra reservoir, but because of an extra reservoir, it gives you a better erection, a more rigid erection, and a more complete erection. And you can also go for a size expansion and a girth expansion with a 3-piece implant. Now coming over to the rigid implants, the rigid implants are imported as well as Indian made. The Indian mades are very cheap, and the imported one are obviously they are costly. They will give you an erection which is rigid enough, but then they are not conceivable. You will always have a rigid penis, so you have to actually wear your penis up when you are putting in an underwear, and therefore that's the only problem with the rigid implant. And these implants are now offered at our center at a very reasonable rates, and we have done couple hundreds of them, and the results have been very good. So if you want and you want to know about the erection, you can go to our link, you can go to our site, read about it, and then make up your mind. Thank you for watching this video, and please share it if you want other people to know about it, and if you liked it. Thank you.